and grandparents. So please stick around, take a seat. This will be a good thing. Lots of good information. Sister Zoller's coming. Steve's here. Arthur's here. So, come on, Kenneth, come and sit down. So, please find a seat. We're going to get started here in just a second. So we are on the countdown now. 10, 9, 5, 2. Much more quality. Okay, thank you all for coming. Gavin, they're all sitting down here, man. Okay, so May Holland, our distinguished member of Soul Parkway Church of Christ, it's all yours.
Good morning, church family. I want to thank everyone for staying for the aging presentation by our Dr. Teresa Marshall. All of you know our dear sister and love her, and there's really not much I need to say except that I hope that you will learn something new. Maybe you'll have some answers for Sister Marshall, that you will be able to ask her some questions. And we're not going to hold you a long time today because we know today the Chiefs are playing today and you will want to go home. Okay, oh my goodness. Yes, okay, we won't help you. We will not hold you very long. Anyhow, Sister Marshall can find out things that are wrong with me if I stand up and talk a long time because she is my doctor, so she'll be watching me as well. So thank you very much for staying today and listening to us. And I won't hold you much longer. I'll give you now Sister Marshall to present to you the subject of aging.
Hi, like she said, I won't keep everybody long. I know the Chiefs are playing today, so we have to get home and watch them. So aging is a broad topic, so I asked Sister Holland, I texted her and asked her what she wanted me to talk about. I found this scripture: gray hair is a crown of splendor. It is attained in a way of righteousness. My husband has a lot more gray hair than me, so you can see he has a lot more righteousness, but we are great. To age is important. It's a blessing to age. And so when I asked Sister Holland, what do you want me to talk about when it comes to aging? It's a broad topic. She said, I think when people become older, there are certain things about their body that they need to know. They need to know what to eat and do to stay healthy and take care of themselves. They want to know how to take care of themselves so they don't just sit down and waste away. And so made me kind of gear my talk today to those type of topics, things that can help us stay healthy so that we can have a good quality of life. And on those things, I wanted to focus on health of the body and the mental health and your physical health. And so I started out with talking about, the first thing we'll talk about is preventive care screening. When we talk about preventive care, what do we mean? When we talk about preventive care services, these are services that help prevent problems or find them early enough so that we can be treated for these problems. And these are things like going to your doctor regularly, getting your lab work, getting your immunizations, despite what RFK is saying. All of these are good things that you want to stay on top of, and these are ways that you can. So I went through and just kind of did a few of the main screenings for seniors. If you are a man between the age of 65 and 75 and you have ever smoked, you should have a screening for an abdominal aortic aneurysm. The reason this is because if you have an abdominal aneurysm, which is the big blood vessel in our body, if it were to rupture, there's a 75 to 90% chance that you would die from that rupture. So by getting a screening, we can find these early and treat and prevent rupture. So that's something. Breast cancer screening. All women between the ages of 40 and 74 should be getting your annual mammograms. After 74, should you stop getting mammograms? I still get my patients to get mammograms. It's a decision that you talk with your doctor about. If you decide, if I have breast cancer, I'm not going to do anything about it, then you don't need to get the mammogram. But if you still want to, you can still get them even after 75. Pap smears, after 65, you don't need a pap smear. A lot of women are like, oh, no, you don't need one after 65. We know that cervical cancer is more of a young woman thing, and so it's sexually transmitted. A lot of things we've learned about cervical cancer. So after 65, you're done with that. Colorectal screenings, that's your colonoscopy. Cologuard, which is another test. A lot of people don't want to get the colonoscopy. You have to miss work, you have to do a day of prep, I get it. The Cologuard is a new test where they send you a kit and you do put in a sample of your stool and you send it back. They check for DNA, blood, different things in the stool. And with this test, it can take the place of your colonoscopy. There's no missed time for work and it's good for 3 years. If it does come back abnormal though, you will still have to do a colonoscopy. Lung cancer screening. If you have been a smoker between the ages of 50 and 80, and you have what we call a 20-pack year history, which your doctor can calculate that history, you should have a yearly CT of your lungs. This again is to catch a lung cancer early to prevent death. I've had patients myself that I've picked up lung cancers that never would have been picked up had we not done the screening, so that's important. Osteoporosis. Any woman over the age of 65 should be screened every 2 years for osteoporosis. Osteoporosis is softening of the bone. With osteoporosis, you have increased risk of breaking the bone if you fall or anything like that. So it's important to have that screening. Anybody who's overweight or obese between the ages of 35 and 70 should be tested for diabetes. Diabetes is very prevalent in our community. Diabetes increases your risk of heart attack, stroke, kidney failure. It increases your risk of losing limbs. It is a very serious medical condition that we can treat. So you should, and that's all part of going to your routine screenings with your doctor. Cholesterol. Anybody between those ages of 40 and 75 should be getting their cholesterol checked as well, because we have great medicines to lower the cholesterol, thus lowering your risk of heart attack, stroke. Tobacco use. Nobody should be smoking. Not socially, not period. Smoking is bad. Smoking causes lung cancer, bladder cancer, COPD, emphysema, heart attack, stroke. Smoking causes death, okay? So nobody should be smoking. We have a lot of ways as doctors that we can prescribe medicines, things we can do to help you stop smoking if you are in fact a smoker. Unhealthy alcohol use. I'll never say you can't drink, but it's that daily excessive alcohol use that a glass of wine here and there, a cocktail, those are fine, but you don't want to have excessive alcohol use. And the same thing with unhealthy drug use. Marijuana is legal now. Every time I turn around, someone's getting gummy, but just be careful with that. And then obesity screening. We know obesity is another big risk factor in our community and period in the world for related morbidity and mortality. And I put that down. Morbidity refers to sicknesses or diseases. Obesity increases your risk of diabetes, high blood pressure, high cholesterol. So that's the morbidity. Mortality refers to the deaths that occur because of your diabetes, your high blood pressure, your high cholesterol. So weight loss is really paramount in helping to reduce some of those conditions and actually make our health better. So vaccinations, okay? These are the vaccinations that we should be getting. You should be getting an annual COVID vaccine if you're over the age of 65, if you're under the age of 65 with any type of medical conditions, diabetes, asthma, COPD, heart disease, you should be having a yearly COVID vaccine. You should get a yearly flu vaccine, okay? The Tdap, a lot of adults, the Tdap stands for tetanus, diphtheria, and pertussis. Especially now we've seen pertussis or whooping cough come back out again. And so because of that, if you have not had a Tdap, you should get one if you're gonna, because we are seeing those cases, and then that's in every 10 years. Shingles, if anybody's ever had shingles or seen anyone with shingles, you know you don't want shingles. And we do have a vaccine now that can reduce, so if you do get shingles, you won't have the severe case of shingles. It's a 2-shot series, and anyone over the age of 50 should have it. Even if you had the old version years ago, the Zostavax, you should still have this new version of the vaccine. The pneumonia vaccine, anybody over the age of 50. RSV is new, just came out in the last couple of years. Respiratory syncytial virus is a common virus. Kids have it, so your grandkids bring it home. But as we get older, we're more likely to develop pneumonia and complications. So everybody is a one-time shot to get the RSV. And then the MMR, we know now measles is out there. We're hearing all about it. If you were born before 1957, you don't have anything to worry about. You have natural immunity because you likely had measles as a child. Anybody born after 1957 should be tested. Like you can get the blood work and we can test to see if you're immune. If you have the immunity, nothing to worry about. If you don't, we can give you the vaccine for the measles. Okay, so that's just preventive care. Then I thought, let's talk about, what Sister Holland said about keeping ourselves healthy. We have to think about our mental health and our body health. So the first thing I want to talk about is dementia. So what is dementia? Dementia is just a general term for decline in your mental function. Like your trouble thinking, reasoning, memory, that's dementia. There are lots of causes of dementias. We have Alzheimer's disease, vascular dementia, Lewy body dementia, other medical conditions like Parkinson's associated with dementia, infections of the brain, head injuries. So there are a lot of things that can cause dementia. And this is things just for you to look at for yourself, your family, your spouses, your parents, things you'll start seeing that makes you think, could this be dementia? Memory loss. It's going to be short-term memory loss first. They'll be able to tell you what happened 80 years ago, but they will not be able to tell you what happened yesterday. And so that's one of the first things you'll see. Trouble with planning, problem solving. I had a patient one time, her daughter let her make the Thanksgiving turkey, and she gave her the aluminum pan, and she put the turkey in the plastic top rather than the aluminum bottom, and put that in the oven. She wasn't able to remember something that was common and she should have. Disorientation, changes in mood. Somebody becomes angry all the time, irritable, they're yelling, snapping, and that's not their typical personality. That's something you have to start thinking about. Could that be dementia? So I did this slide, what can we do? Because that's what Sister Holland said. What can we do to stay healthy? Be physically active. We should try to get 150 minutes of exercise in a week, 30 minutes 5 times a week of moderate activity. Eat a healthy diet. I do wellness visits with my seniors all the time, and I ask them, how many servings of fruits and vegetables do you eat a day? One, none. That's not good. Our diet should be higher in fruits and vegetables, fish, lower in red meat, and lower in fatty foods and sweets. You want to maintain a healthy weight. Keep your heart health together by keeping your blood pressure, cholesterol, all of those things controlled. Get good sleep, 7 to 8 hours a night. Sleep is important, okay? Avoid head injuries. Stay socially engaged. You want to stimulate your mind. Puzzles, reading, board games, all of those things help to keep the mind going. And manage your mental health. We'll talk about that a little bit more. Protect your hearing and vision. I personally wear hearing aids, and there have been a lot of studies here recently that have shown those of us with hearing impairments have a much higher incidence of dementia, as well as people with visual impairments. By treating those things, you can decrease your risk of dementia. And then, like we said, don't smoke, limit alcohol. So, mental health, depression and anxiety. Depression and anxiety is very common as we get older for lots of reasons. We have loneliness, poor health, different things like that. I know as Christians we tend to say, oh, I'm not depressed, I'm just going to pray about it. And I believe in praying about everything, but we also have to put that work in too. You know what they say, faith without works is dead. We have to recognize depression and treat our depression and anxiety. So these are just symptoms of depression and anxiety. Sadness, emptiness, loss of interest and pleasure. You see, mom doesn't want to go out to the movies, doesn't want to go to church, and Julie has been going to church every Sunday. These are things that you say, okay, mom may be having some depression. Irritability, sleeping too much or not sleeping at all, not eating, trouble concentrating, unexplained physical problems. A lot of times depression will just manifest as somebody is complaining all the time. Thank you, baby. Thank you. Is complaining all the time about, oh, my head hurts, my arm hurts, my back hurts, and there's nothing really that shows why they should be having these pains. And sometimes that's a sign of depression. And then thoughts of death or suicide. Anxiety, similar symptoms, nervousness, worry, not wanting to go out, restlessness, shaky, nausea, rapid heart rate, headaches, dizziness, avoidance of social situations. I don't want to go to church because there's too many people talking to me. I don't want to go to the grocery store, all those people around. Those are all things that you want to look at. And so these are the important considerations when you look at elderly patients with the depression. The physical symptoms, like I talked about, memory and concentration. A lot of times we'll blow it off as dementia when really it's depression that's causing the memory issues. Social isolation. So many of our seniors are alone, they're at home alone. So talking to people, saying, hey, let's come out, taking someone just to the grocery store, just having that social interaction can sometimes truly help people to feel less sad and less depressed. Loss of loved ones. As we get older, losing your siblings, and everybody you look around and you say, everybody around me is dying. That causes depression. So checking on those people. And then functional limitations. When your arthritis or your heart disease or your medical conditions makes it to where you can't go out or do things, it makes you depressed. So those are important factors to look at. So depression in the elderly is often misdiagnosed and just attributed to, oh, this is the aging process, is that, and by doing that, you miss the opportunity to treat. We have great medications to treat depression, counseling, therapists. These are things that truly help. And so if we misdiagnose it, so it's important if you're feeling depressed or if you feel your spouse or your parent or somebody that you speak up, okay? Untreated depression causes worsening outcome of your regular illnesses because you're not taking your medicines, you're not eating right, you're not doing those things, and then you're more likely to have complications. The untreated depression has a link to dementia and Alzheimer's. It can lead to alcohol addiction, drug misuse, because you're self-treating at home, and it's a significant risk factor for suicide. And surprisingly enough, elderly, especially elderly men, are more likely to complete suicide, okay? And so the next thing I was going to talk about is frailty in seniors. So what Sister Holland was saying, how we just don't sit around and waste away. Frailty is a medical condition characterized by a decline in your physical and physiological function. So you have more falls, more disability, and you're just frail, like the word says. So what can I do to reduce my frailty risk? Exercise. Here we go again, exercise. 30 minutes of weight-bearing aerobic exercise 5 days a week. You know, the nice thing with most senior citizens is the insurance companies now pay for the Silver Sneakers program. And they have programs, and then with you guys with your wellness program, there's even stuff you could do at church. I have a patient, her church, they do line dancing at church. And dancing is a good aerobic exercise. So, you know, running, jogging, jumping rope, those are kind of hard for some of us, so we're not gonna do those. But dancing, walking, using your elliptical machine, yoga, tai chi, water aerobics. Water aerobics are also great on your joints. These are all great exercises to help keep you from, and it strengthens your muscles, strengthens your bones, and so you're stronger, less likely to have a fall or injury. Focus on nutrition. Here we go again, the balanced diet. I had a few handouts that I printed out if anybody wants on the Mediterranean diet. Sorry, the Mediterranean diet is a plant-based diet, but it focuses on having fruits, vegetables, legumes, more fish and poultry, less red meat and sweets. And so she's gonna pass those out. And so manage your weight, we talk about that, exercise and diet. Stay hydrated. Make sure you're getting in 6 to 8 glasses of water a day. Manage your chronic conditions. Review your medications. Talk to your doctor. Don't just stop your medications. Oftentimes you'll get a medication, you don't like how it makes you feel, you stop taking it. 6 months later you see the doctor, you say, I ain't taking that. Don't, you know, if it's not working, call your doctor, make an appointment, let them know this medicine makes me feel this way, and then that way other medications can be tried. You know, be an advocate for your health. Make sure you're getting in plenty of vitamin D. As African Americans, we tend to have lower vitamin D. Get your regular screenings that we talked about earlier. Stay socially engaged so you don't feel isolated, because again, that increases your risk of frailty. So activities where you're going out around others, prevent injuries, use your cane or walker. You can still be cute and use a cane or walker, okay? So I know, use your cane, use your walker. Don't have rugs in your hallways. Rugs in your hallways are fall risk. As we get older, we don't pick our feet up enough, higher risk of falling. You want to make sure you wear your seatbelt and have good lighting in your home. Just having things dark in your home increase risk of tripping and injuries. So those are things, and then seek community support. There are a lot of programs out there to help with transportation to and from appointments. There are a lot of programs that help with if you're having issues with affording medications, affording foods, but just talk to your doctor about those type of services that are available. And so I think that was it. So if anybody had any questions?
I have a question about, one about.
Hold on, sister. Get on.
I do. I had 2 questions. The first one, you mentioned about women and breast cancer. I lived in Burlington, Kansas several years ago, and the person that was over the hospital, this was a man, and he was saying how important it's not as stressed about men and breast cancer, and he mentioned back then about 2% of men, so I encourage men to go do the screening. The next one was, how do they come up with what's the right type for us as black people with our weight? You know, they give this, what's for us as black or people of color?
And that's a good question. The BMI calculator is not a great indication of your personal health, and that's when your relationship with your provider and everything comes into importance. Studies have shown that just a 5 to 10% body weight loss will decrease your risk of diabetes, high blood pressure, and high cholesterol. So if you have someone who weighs 300 pounds and they lose 10% of their body weight, that's just 30 pounds. So even at 270, the BMI calculator is still going to say they're morbidly obese, but they've already decreased their risk of diabetes and high blood pressure. I always tell my patients, I use myself as an example. I had gastric bypass surgery, so I've lost about 160 pounds, and I was able to come off all of my diabetes medicines, all of my blood pressure medicines, but I'm still considered obese according to the BMI calculator. So we have to look at your individual circumstances. And unfortunately, men with screening, there's no guidelines now where insurance will cover screening, but men should check their breasts, and if they feel something, we can order a mammogram. They don't like it. I've done it on several men, and they can get it done.
Question.
Why do they stop doing colonoscopy at 75?
Okay, because like with colon, it's insurance. Insurance won't pay for it, okay? And it's unfortunate, insurance looks at somebody, most colonoscopies are every 10 years unless there was something abnormal. So at 75, they're thinking that's 85 when you'll get your next one. The insurance doesn't view that as lucrative, so to speak. I mean, they figure you'll be 85, you're not gonna be, and so that's unfortunately how they look at it. And so if you were to have an issue though, blood in your stool, something, I can get those tests done, but just as far as a screening test, that's why they stopped covering it.
How about prostate? I didn't hear you say anything about that.
Thank you. I didn't say that. I was just thinking. So prostate cancer is much higher in African American men than in other populations. And so the guidelines have extended the age that we should be doing blood work, testing of your PSA. I start at 40 to 45, depending on the history, getting a PSA screening for my male patients. And you should get blood work even up until 75, kind of the same type of knowledge as with the other things, but at least to the age of 75, you should be getting your yearly PSA screenings. And it's just blood work. They don't do the digital rectal exam anymore, luckily. Men not like that, so.
I'm 82 years old.
Yes, ma'am.
Where do I stop?
Where do you stop?
Yeah.
Okay, this is what I tell people. If you want to get a mammogram, this is what I would tell you if you were my patient. I would look at you and say, okay, if I found out today that you have breast cancer, are you going to do surgery? Are you going to do chemotherapy? Are you going to do radiation? Or are you going to just say, no, I'm going to leave these breasts how they are? And if you would be willing to do the treatment, I have a 91-year-old patient that just finished treatment. She thanked me for getting her mammogram because she said she wanted to have the treatment. Whereas I have some 75-year-old patients that are like, nah, I don't want that. So it's just kind of your relationship with your provider and what you feel comfortable with.
Okay, good. Thank you.
Okay. Hold on.
Breast exam